Good day, my informed Medicare crowd. Thank you for tuning in and congratulations. You just turned 65 or you're about to turn 65. And guess what? About 3 months before your 65th birthday, you get this red, white, and blue card in the mail. And on it has some numbers and letters, and it says Medicare Part A and Medicare Part B, and gives a date. It's usually going to be the first day of your birth month in that year. So congratulations, you're now Medicare eligible. What do we do? Well, I'm here to help you with that, all right? And this is probably the most important part of choosing a Medicare plan is when you're first eligible. Because there's two main routes to choose from. All right? And these two routes are very different and can affect you in different ways. So I will start with the easier route. The first route is called a Medicare Advantage plan. And you may have heard of these. The HMO, PPO is something maybe you're familiar with, like your employer coverage was a HMO or a PPO. These plans, there's a big debate on which route to go. So let's not get ahead of ourselves, and we're just going to start with the Advantage plans. Advantage plans are great. They combine coverage together. So they take your Medicare, which is your hospital and your doctor visits, and they combine it together with your prescription drug coverage, and even can give you like dental and vision and hearing, so that you get all that wrapped into one. And depending on the plan and where you live, there can be even additional benefits like transportation, gym membership, the stuff you hear about on those commercials every October 15th through December 7th. And you will hear about them. They're always on, repetitively. And if you don't see a commercial, you'll get a phone call, especially once you hit the age 65. So, Medicare Advantage plans are one route you can go. And the reason people choose this route is more simplicity as well as cost effectiveness. Because Medicare itself, Part A doesn't cost you anything as long as you've lived in the United States and worked at least 10 years and paid into Medicare. So you've earned Part A. Part B does have a charge. And for 2026, it's $202.90 per month. And they will take that straight out of your Social Security check, or they will bill you for it if you're not getting a Social Security check. So you're already paying for A and B of Medicare, which makes an Advantage plan most of the time you can get for $0 additional dollars. So since you've already earned Part A and you're paying for Part B, an insurance company steps in and takes over Medicare for you. And at that point, they will now kind of determine the rules and your cost and the benefits of your plan based on, again, your area and what the plan itself is providing for you. So this is primarily the route to go, and it's become much more popular in the last few years. It used to get a really bad rap, honestly, and there's a good reason for that. People did not like Medicare Advantage plans because one of the reasons the insurance companies are able to give you so many extras like dental, vision, hearing, gym membership, etc., and not charge you any additional premium is because you are restricted then to using only doctors that will accept that plan. And there are differences between HMO and PPO, which is a health maintenance organization or a preferred provider organization. Those terms don't mean anything to you. Don't worry about it. What you need to know is, does your doctor participate with the plan that you're looking to enroll into? And are you going to get the benefits you want out of this particular plan? So that's a quick rundown of Medicare Advantage plans. Now, the other route to choose is what's called a Medicare Supplement plan. And they're easily confused, as you can tell, because the names are so close to each other. But a Medicare Supplement plan is also offered by insurance companies, but it's not tied to Medicare directly. It just goes alongside Medicare. So your A and B will pay. Your A will pay the hospitals, your B will pay the doctors, and then your supplement plan, there's different rules for different supplement plans, but for the most part will pay what A and B doesn't pay in order, to cover your healthcare costs. Now, these plans usually do have a premium every month, and they cost, sometimes quite a bit more, especially a lot higher if you compare it to a $0 Medicare Advantage plan. It could be $200, $300 a month. And they do not include things like dental or vision or hearing benefits or the gym membership, any of the extras that the Medicare Advantage plans throw in there. So you're getting healthcare coverage that you're paying for every month and not getting any of the extras. So right now it seems like, well, why would I choose to pay for something when I could get it for free, right? Or not technically free, but get it for $0. So Advantage plan is $0. Supplement plan is maybe $150, $200, $250, depending on which plan you choose per month, above the $202.90 that you're already being charged for Medicare Part B. Why would you do that? Why pay more money to get less benefits? Well, here's why. First, a supplement plan does not have networks of doctors to stay in. So with a supplement plan, you get the ultimate freedom of choosing whichever doctors you want to use. So this grants you the ability, if you live in Florida, to go to a specialist in Minnesota, or vice versa. And the other reason is you don't have that insurance company in there kind of dictating what procedures you can get and if things are medically necessary. So what I mean by that, with an Advantage plan, and you say you need surgery on your shoulder, an Advantage plan, you'll have to get approval from first Medicare and then prior approval for the surgery from the insurance company. So there's 2 steps it has to go through. Even though your doctor says you need it, it has to get approved by Medicare and then approved by your insurance company. With a supplement plan, you get to avoid that second step. It just needs to be approved by Medicare. As long as Medicare approves it, then it will be covered by your supplement plan. So it does cost more for a supplement, but it gives you more freedom and flexibility to choose which doctors you want to use. And you don't have to go through that added layer of what's called prior authorizations to get the insurance to pay for your procedures. So supplements if you can afford them, are a more flexible way to go with your insurance coverage. And what's most important is when you first become eligible for Medicare, right? We just turned 65, congratulations, cards in the mail. When you first become eligible for Medicare, you can get into a supplement plan without the health insurance company asking any health questions. This is called guaranteed issue. It means you get into the plan at the best rate, and they cannot ask you health questions and raise your rate or even deny you coverage based off of that. Whereas a Medicare Advantage plan is never allowed to ask health questions. But the trick is, if you're gonna go the supplement route, is to do it when you first become eligible for Medicare, because then you're gonna get the best rate without having to answer any health questions. If you wait 2 or 3 years and then try to get a Medicare supplement plan, they're going to ask you a bunch of health questions, and your rate could increase, or you can even be flat out denied by the insurance company because of pre-existing conditions. So if you go the supplement route, which does cost more and provide less benefits, you do need to do it when you first become eligible for Medicare, because then you'll at least get the best rate and don't have to go through medical underwriting. If you go the Medicare Advantage plan, you don't ever have to worry about health questions, and you do get the extras like dental, vision, or hearing. But what you're missing out on is the ability to choose your own doctors completely. I mean, you can still choose your own doctors, they just have to be within a network with the Advantage plan. With a supplement plan, any doctor that accepts Medicare will take the supplement plan. And then also, a supplement plan avoids the prior authorizations. So your doctor with an Advantage plan has to call in and say, look, this surgery is medically necessary because of reason A, B, and C. The supplement plan skips that step. If Medicare approves it, it will be approved by the supplement plan. So even though it's more expensive and provides less benefits, you have greater flexibility in choosing your doctors and more likely to get coverage for procedures that are requested by your doctor. You don't have that extra step of going through and asking the insurance company if it's okay to get it done. They will approve it if Medicare approves it. So 2 main differences to recap. Medicare Advantage plan, definitely great if your budget is restricted and you're okay with staying in a network of doctors, which the networks are really large now. They're not like they used to be. They're actually very big, and as long as you get a reputable insurance company, you shouldn't have any problem staying in your network of doctors. The only problem with the Advantage plan is sometimes you need to get that prior authorization, and that means not only Medicare has to approve it, but the insurance company has to say that it's medically necessary in order to pay for it. But by doing that, you pay $0 a month and you get your coverage with dental, vision, and hearing. And then you just have small co-payments as you go along. So you might have a co-payment for a specialist, or a co-payment for an MRI, or a co-payment for some blood work or an x-ray. But you're paying $0 a month, so it's okay. The supplement plan, on the other hand, will cover most of the costs that Medicare doesn't pick up. So they will allow you to have and go see the doctors with no network and typically not very many copays, if any copays at all. You just pay a monthly premium and you can go to the doctor and get all your tests done and know that you're going to be covered. The Advantage plan, opposite. You don't pay a monthly premium, which is great, and you get more like dental, vision, and hearing and gym membership, but you will have little co-payments when you use it. I hope that helped clarify the difference between Medicare Advantage plans and Medicare Supplement plans. And again, the importance of this can't be stressed enough, is when you're first eligible for Medicare, if you're going to choose a supplement plan, that is when you want to go with it. When you're first eligible, within your first 3 months of becoming eligible for Medicare. Go the supplement route if you can afford it and want that flexibility and don't want to have to ask the insurance company for permission to get procedures done. Otherwise, a more cost-effective way is an Advantage plan. You just have to follow some of the rules the insurance company lays out for you. And by doing that, you get a lot of extras and you don't pay much, you don't pay anything per month, and you just have small co-payments as you go along. So that's video number 1. Thank you for watching Informed Medicare, and I hope this clarifies the biggest choice you need to make when you first become eligible for Medicare. Do you want a Medicare Advantage plan, or do you want to go the Medicare Supplement plan route? Thanks, guys.